There are multiple challenges when we talk about implementing precision medicine, and one of the major challenges is just being able to get the right amount of tissue. Tissue availability is a very large issue right now, and there are some exciting thoughts around that with liquid biopsy and some of those technologies coming out, but tissue availability is very much an issue right now. Another issue is just being able to have a biopsy at the right time. So once a patient has been on therapy, that first tissue biopsy that you would have received would not really be applicable to that patient. And so making sure if you do have tissue that it's relevant tissue for the cancer or the tumor that the patient has. Of course, cost is certainly something that's coming up at any meeting I go to, and especially when we talk with patients. That's a large driver behind the cost of the test and then the cost of the therapies. Again, resistance is another issue. That resistance mutations that arise from these targeted therapies, that's an issue that has to be addressed. And I know that many combination therapies and thoughts are coming into play with that. And then as always, education. I mean, this is a very large field, and so having the knowledge of all of the different alterations and how they have an impact upon the patient's tumor and their cancer is also a challenge.